Alcohol in your health. After 50, what you should know. Hello there, it's so good to see you today. I want to have a little heart-to-heart about something many of us enjoy. A drink with friends or family, maybe a glass of wine at dinner, a beer at a celebration, or a cocktail to unwind. Drinking is a part of life for many people, and it can be a lovely way to relax or socialize.
But here's the thing. While alcohol can bring some joy, it can also affect our health in ways we don't always expect. And that is what we are going to talk about today, how alcohol affects our health and what you can do to keep yourself safe and feeling your best. So, let's get started. Why do people drink? You know, drinking alcohol is often tied to happy moments. People drink to celebrate birthdays, holidays, or just to catch up with friends. It can help us feel relaxed after a long day or make social gatherings a bit more fun. But here's a question for you. Have you ever wondered how much drinking is okay? Or what happens to our bodies when we have a little too much? It's important because even though it's a common part of life, alcohol isn't just harmless fun. It can cause serious health issues, especially when we drink too much or too often. How alcohol affects our health. Let's talk about the health side of things. When you think of alcohol and health problems, you might immediately think of the liver, and you'd be right. The liver works hard to filter out toxins, including alcohol. But alcohol isn't kind to the liver. Drinking a lot over time can lead to problems like fatty liver, inflammation, called alcoholic hepatitis, and even scarring or cirrhosis, which can be life-threatening. But liver problems are just the beginning. Drinking too much can affect many parts of the body. For example, heart troubles. Drinking heavily can stretch the heart muscle, making it weaker. It can also cause irregular heartbeats or high blood pressure. This increases the risk of stroke or heart attack. Joints. Ever heard of gout? It's a painful condition where crystals form in the joints, causing swelling and sharp pain. Alcohol can make this worse. Blood sugar. Drinking can raise blood sugar levels, which is something people with diabetes need to watch carefully, and that's not all. Alcohol can damage the nervous system, the network that controls how your body feels and moves. This damage can cause numbness, tingling, muscle weakness, and even problems with bladder control or digestion. Some people develop something called alcoholic neuropathy, which can be very uncomfortable. Alcohol can also trigger or worsen epilepsy by causing seizures, even in people who never had them before. On top of that, heavy drinking often leads to mental health issues like depression, anxiety, and trouble sleeping. It can also make it harder to think clearly, plan your day, or solve problems. All things that make life more challenging. Alcohol and your immune system. Another thing to keep in mind is how alcohol affects your immune system, the body's natural defense against germs and illnesses. Drinking too much can weaken your immune system, making it easier for infections to take hold. This means people who drink heavily get sick more often, with illnesses like pneumonia or even tuberculosis. They're also more likely to catch sexually transmitted infections, including HIV, often because alcohol lowers inhibitions and leads to risky behaviors. Even a single night of heavy drinking can weaken your body's defenses for up to 24 hours afterward, making you more vulnerable. Alcohol and cancer risk. Now, here is something many people don't realize. Drinking too much alcohol can increase the risk of certain types of cancer. This includes cancers of the mouth, throat, esophagus, liver, and even breast cancer. The risk grows the more you drink, so it is something worth thinking about, especially if you have a family history of cancer or other health concerns. Other risks of drinking. Alcohol doesn't just affect our bodies. It can impact our lives in other ways too. For example, drinking increases the chances of car accidents and injuries. It can lead to risky behavior, like unsafe sex or arguments with loved ones. Heavy drinking is linked to relationship problems, including fights and even violence. In serious cases, it can lead to suicide or homicide. And sadly, very heavy drinking can cause coma or even death. What influences alcohol's effects? Now you might be wondering, why do some people seem to handle alcohol better than others? Well, alcohol's effects depend on many things. How much and how often you drink, your age, your overall health, your family history, even things like your weight and metabolism. This means even if you feel okay drinking now,
things can change. A little too much one day or over time can cause serious problems. Drinking problems and aging. As we grow older, our bodies and minds change, and so does the way alcohol affects us. Sometimes drinking that seemed harmless before can cause new challenges with age. Here's why. Body changes make alcohol hit harder. With age, our bodies have less water and fat changes, so alcohol doesn't dilute as much. That means even the same amount of alcohol can feel stronger or have a bigger effect than it did when you were younger. Slower processing of alcohol. Our liver, which breaks down alcohol, slows down as we age. This means alcohol stays in the body longer, increasing the chance of feeling dizzy, tired, or confused. Medication interactions. Older adults often take medications for health issues. Alcohol can interfere with many medicines, making them less effective or causing harmful side effects. Higher risk of falls and accidents. Alcohol affects balance and coordination. Combine that with natural changes in eyesight or muscle strength, and drinking increases the risk of falls, which can lead to serious injuries. Mental health and memory. Alcohol can worsen feelings of depression or anxiety, which are common in older adults. It can also affect memory and thinking skills, making everyday tasks harder. Chronic health problems. If you have conditions like diabetes, high blood pressure, or liver disease, alcohol can make them worse or complicate treatment. Key takeaways. So, what can you do? First, don't feel like you have to give up alcohol completely if you enjoy it. The key word here is moderation. Drinking less or drinking responsibly can protect your health and still let you enjoy those special moments. Here are a few friendly tips. Set limits for yourself, maybe 1 or 2 drinks on special occasions. Never mix alcohol with medicines without checking with your doctor or pharmacist. Avoid drinking when you're stressed or upset. It can make things worse. Make sure to drink water alongside alcohol to stay hydrated. And if you ever feel like alcohol is starting to cause problems in your life, talk to someone you trust or a healthcare provider. Remember, the sooner you make changes, the better you'll feel, and the more you'll protect your future health. To wrap things up, alcohol can be part of life's celebrations and relaxing moments. But it's important to know the risks and take care of yourself. Drinking too much, whether all at once or over time, can affect your heart, liver, nervous system, immune system, and even your mental health. It can increase the risk of cancers and accidents and impact your relationships and daily life. But the good news is, you have the power to make choices that protect your health and help you live your best life. Thanks for spending this time with me. If you found this helpful, please share it with someone you care about. And remember, take care of your body. It is the only place you have to live. Take care, and see you next time.